Welcome to Catalyzing Innovation's podcast series, where exceptional global innovators across sectors share best practices to maximize creativity and practical secrets for good implementation. Hi, everyone. I'm very happy to be interviewing Dr. Freddy Nguyen today from MIT and Mount Sinai. He's a physician, scientist, and innovator. He's a fellow at the MIT Innovation Initiative and former co-director for MIT Hacking Medicine. I heard Freddy give a fascinating talk about the virtual global hackathons that MIT was working on to improve and solve the problems brought about by COVID-19. He spoke at the Disruption Lab in their series about the future of healthcare. And it struck me listening to his talk that other sectors could learn about how to do hackathons better, and virtual hackathons, which really the whole hackathon and brainstorming kind of industry has been forced to go to. And obviously it was an adjustment, but I think that Freddy learned a tremendous amount, and that he can share with us both the learnings from MIT and then some insights that others in other sectors could learn from the process. So thank you so much for coming today, and welcome. So my first question is, can you describe your background and role in developing and implementing MIT's Global Hacking Medicine Hackathon programs? And if you can go a little bit through the time frame and describe the scope, because you did them all over the world.
Yeah, so I've been involved with a group called MIT Hacking Medicine for several years now. And when COVID-19 about a year ago has really started to hit us, a group of us at MIT from various entities, including MIT Hacking Medicine, MIT Innovation Initiative, our Martin Trust Center for MIT Entrepreneurship, and the Sloan School really came together and how can we channel all of this untapped pool of talent and energy and time that people had being in lockdowns and being sent away from school and work towards solving some of the challenges that were facing us part of COVID-19. And so that's how the MIT COVID-19 challenge was born. So it was really a MIT-wide, community-wide initiative that was put together and came together very quickly, but really building on top of the foundation that hackathons we had done through Hacking Medicine and other groups, but now having to obviously pivot them towards a much shorter timeline than we normally would have in planning these, but also on a virtual platform as well.
Super. And can you just tell a little bit about your background in terms of your specialty, if you practice medicine, how you're involved in innovation, because it seems like a passion of yours, and you've taken your career in the direction of really innovating in new technologies and new approaches. So it's just interesting from a career standpoint, the different influences that you deal with. It's very broad, but I think you need a certain skill set beyond being just a doctor to do what you're doing.
Right. So I did my MD PhD training at University of Illinois Urbana-Champaign, and then came to MIT for postdoctoral fellowship. And my research background has been more on the bioengineering side, physical chemistry side, which has been in two realms. One is in the development of optical imaging and spectroscopic techniques for cancer diagnosis, as well as in the field of nanotechnology, building basically nanoscale biosensors that can be used to detect small molecules such as, chemotherapeutic drugs or drug delivery, monitoring, or essentially hydrogen peroxide, nitric oxide sensors to kind of look at how cancer cells respond to chemotherapy and so on. So those have been kind of my core, I would say, research that I've been involved in. On the clinical side, I'm doing my residency in pathology and clinical pathology right now at Mount Sinai, and will be specializing more in the transfusion medicine side, so which covers both the blood banking as well as apheresis services, which I'll end up doing a fellowship at Dartmouth for in a year from now. So, and then, so as you can tell, my background has been involved a lot in the engineering technology development side, instrumentation development side. And had always wanted to see how these technologies ultimately end up having an impact, right? So end up being commercialized, end up being put in use with patients or with clinicians and so on. And so that was kind of how I got interested in the innovation entrepreneurship space. And so when I came to MIT, just like a lot of others at MIT, that really wanted to explore that ecosystem, and that's how I got involved with hacking medicine, that approach as well.
That's awesome. So when I heard you speak, you talked about the program's goal of making innovation more accessible. And, I thought that was a great goal, but can you explain why that's needed and how the hackathon program at MIT tries to do that?
So for us, we truly believe that good ideas can come from anywhere, right? And doesn't necessarily have to come specifically from MIT or from the ivory towers of our academic institutions. And that's, really at the heart of what we mean by trying to democratize healthcare innovation and making it more accessible to others. And so, but usually some of the big challenges that people have towards entering the space of innovation entrepreneurship, especially within healthcare, is just the access to people and the access to better understanding the problem, figuring out who are the people who are facing those problems to gain access to, whether those are the clinicians, whether those are the patients themselves. And then the second difficulty that people have is access to other like-minded individuals who want to problem solve, but who may not be in their immediate circles already. And so I think the hackathon is one great way to solve both of those problems, which is being able to bring in the people who have the problems or who are facing them day in and day out with the people who want to solve these problems and who have the skill sets to solve these problems, while at the same time creating this community of innovators and entrepreneurs that hopefully tackle some of these problems together. But even if they don't happen to tackle that problem, particularly at that weekend, we've now equipped them with not just the process and the procedure that we take during our hackathon in terms of design thinking and being very problem centric and really taking into account the multiple stakeholders involved as part of that process. But also now that they've plugged into a community of individuals that they can reach out to and continue with, not just as fellow participants or fellow problem solvers, but also thinking about the network of mentors that we bring into this space as well.
So it's interesting. It sounds like you've really increased the awareness of these hackathons and made a very concerted effort to bring in more different types of people from all over the world. So can you explain, that's to me one of you've done many different great things, but that's one of the great things about, I think, how you've evolved. So can you talk a little bit about how you spread the word? I know you got terrific participation. I'm going to ask you just to describe the hackathon programs. I don't know if it's better to start there, but then how you got such great participation globally, both from around the world, but also from different sectors or different types of people than might have traditionally in the past participated.
Yeah, that's a great question. And I think we've always wanted to have a multi-stakeholder approach to the participants in our hackathons. I mean, that's been at the center of what we do at Hacking Medicine. And we always want to make sure that we have everyone from the clinicians, the scientists, the engineers, the patients, but also the payers, the business side, the legal side, user designers, kind of every major stakeholder you can think of that would be involved as part of the healthcare problem. Now, specifically with the COVID-19 challenge, I think what was unique about that is that we had to mobilize in a very short timeline. I mean, I think literally from the moment we decided to within the first 48 to 72 hours, we're able to develop and form relationships and partnerships with about 20 to 30 other organizations external to MIT. But then also within that same timeframe, really coalesce the MIT community behind it from, not just within MIT Kern, but also through the MIT alumni ecosystem and network as well. So but that was really done well due to the fact that we already had a lot of these pre-existing relationships. And so when I talked earlier about the community that we're building, this is a community that we've cultivated over the years already. And so these were entities that had worked with MIT and with Hacking Medicine and other groups on campus in the past, who were already familiar with our program, already familiar with the people who were executing on this program, and said, we're all in, and let's just get this done, so to speak. And so from there it just snowballed essentially, as they shared within their own networks and brought on new partners as part of the event. And I think that's one of the great things about MIT is that because of our past work, we've really been able to play this neutral broker, so to speak, and being this, having a bit of this convening power to bring in very diverse stakeholders as part of solving these problems.
So I think there was tremendous interest in participating. One, because of the urgency that everybody knew, like how critical it was to come up with solutions as fast as possible, and two, the respect that MIT has in the innovation space. But can you share like who some of the partners, unfortunately, people can't see your PowerPoint, but could you just share who some of the partners were?
Right. So, for us, knowing that we wanted to initially have a focus, directly within the healthcare space, we started off with building out a coalition of clinical partners that we work with. And so those included the Mass General Brigham, the National VA system across the US, Weill Cornell, Oregon Health and Sciences University, to name essentially were our core clinical partners that were involved, and they were able to provide us with some of that direct problem sourcing from the front lines. But then we also had partnerships with big tech, so we worked with Microsoft and Google and Amazon over the course of the challenge. We also had partnerships with pharma, so Takeda and Pfizer and J&J were some of those entities. And then we worked also with a lot of incubators and accelerators and other trade groups that were essentially highly involved in mentorship of startups and within that ecosystem. But a lot of it was, I think, again, as I mentioned, really built on the network that we had before, and really ensuring that we had all of those stakeholders from the healthcare ecosystem represented, because we all know that we complemented each other in terms of our various expertise, not just expertise, but also kind of what stage of development that they would have. And because we wanted to have an equal focus on not just the hackathon itself, but also what happens after the hackathon, because our interest really was to go from ideation to impact. And so really thinking about that full pipeline, about how do we set this up in a way that would guarantee the best success for these teams in the long run, was really at the forefront of our thinking.
Oh, it's amazing. So can you just describe the geographic rollout, like where you started? And it was fascinating to me because you did the hackathons on almost every continent virtually. And I think there are different needs. While, from a fighting the virus standpoint, everybody's the same, physiology or genome sequencing or whatever, but there's still different needs in terms of healthcare delivery on different continents. And so you kind of customized a little bit, I think, the challenges in different markets. But can you just talk a little bit about the scope of the program and how you rolled it out in a relatively short period of time from continent to continent?
Yeah, I mean, the first event was the Beat the Pandemic event, which, although intentionally, it wasn't necessarily intentionally a US focused space, but that's just how it turned out, just because of the partnerships that were involved. And that's who was instrumental in the recruitment of participants and mentors and so on. So and then from there, our team was kind of looking at where was the needs of the virus so far, where were the cases rising and so on, and that's how we rolled out in these other geographic areas that we basically pivoted towards the African continent. A few weeks before really the major surge that happened there, and kind of similarly when we went to Latin America and to India as well. and that shifted, of course, the types of partners and which partners we had to engage as part of those events as well. So um, and the needs are very different, even if the problem may be the same across all of these, which I think there was a lot of shared problems across globally. But one has to remember that the local ecosystem is very, very important in terms of not just how we define that problem, but how the potential solutions are more feasible, in Africa versus in the United States. A solution for the same problem that's being built out for the US market is not necessarily going to have the same adaptability as it would in India or in Africa. And that's not, and that's, the thing that contribute to that is everything from the existing infrastructure that's there, to the culture of the population there, to the education levels and the resources that are available there. I mean, even in the execution of the hackathon itself, when we were planning for the Africa event, we were thinking about, okay, they have curfews in place right now there. They have restrictions on where they have reliable access to the internet. So how do we ensure that we can build this hackathon to take those considerations as well, so that we can make sure that we had good representation from, again, the people that are on the ground facing those problems day in and day out. Which is why, I think we were very, very pleased that each of those geographically centered hackathons that we did had such huge participation. At least 50 to 80% of the participants ended up being from each of those respective continents.
Fascinating. And then one of the things I wondered from an execution standpoint is how you decide who to put on what team. I'm not sure the number of people on any one team, but you're combining different people with different skill sets. And how do you decide that?
So it's completely organically formed. So the participants come together on Friday night most of them without any kind of pre-formed teams, which is the whole idea, because I think from our perspective, what we've come to find is when people come in on a very equal level playing field without knowing each other or having preconceived notions or ideas, is when the best ideation happens. But the way the teams are formed is that on Friday evening of the event, any participant is given the opportunity to pitch the problem that they want to tackle over that weekend. And then the participants essentially mix and mingle with each other to then form teams around that, with our guidance, of course, to remind them that they really need to build out that diverse team between the various stakeholder groups that we mentioned, between the clinician, the scientists, engineers, etc., to gain that diversity. And if we do see that there's a lack of diversity, we will certainly kind of come in and try to change that. Most of the team sizes are between 4 to 7 participants. We've come to find that's just about the right number, in terms of it's not too few where you don't have enough diverse backgrounds to really carry forth with that ideation process. But also it's not too much where you're going to have people that feel like they're completely being left out of the conversation or the ideation process.
Interesting. So how has COVID changed the way MIT science-related hackathons are going to be done going forward? And maybe all hackathons, I don't know. But historically, I'm guessing they were not done virtually or as virtually. So I'm curious, what are some of the key learnings that you think maybe will be kept in the future and may have even been enhancements to the process? I'm sure you learned a lot, because it was a very different way of doing it than you've done in the past.
Yeah. Now, this was, in my time at MIT, this was certainly the first set of virtual hackathons we've ever done, especially on such a large scale. And traditionally, Hacker Medicine does in-person hackathons about 20 to 30 times a year all over the globe. And so there's definitely was a lot of changes, not just the physical, the changing to a virtual platform, but just thinking about some of the more logistical things in terms of what are the time zones that we should be making our event centric to? How do we deal with that component? How do we deal with the technology? I think moving forward, there's pros and cons to both sides. I think from our experience, the live hackathons still, I think, provide the best ideation, because I think it's kind of an irreplaceable type of interaction in terms of the dynamics within a team, all being huddled around the same, physical space to ideate and to work on these solutions. Whereas when we're in the virtual environment, sometimes some people are on, some people are not. Like, it's a little bit of more asynchronous type of interactions that are happening, and so kind of the back and forth doesn't happen as quickly. But I think the virtual hackathons, the pros there that's happened is that it's certainly broken down more barriers in terms of access to these events. And by that, I mean that first off, you've broken down the financial barrier and the time barrier of people having to, fly out to some place and have accommodation someplace to participate in a hackathon. But then the second part is that we now we're also able to tap into a mentor pool that is, really global in that sense. Because before, we normally would tap into a mentor pool that's fairly local geographically to where the hackathon was held. But now we can have access to really the global pool of really top talent to mentor these teams and work with these teams throughout the hackathon. So I think those are some of the virtues of the virtual hackathon. In terms of how will this change our hackathons in the future, I can certainly see a component, a bit of a hybrid, where we could bring in some of the, especially attracting mentors globally in terms of our live hackathons. But I don't necessarily foresee that we would have a mixed hackathon where some participants would be in person and some would be virtual. I think that disconnect is a little bit too much, especially for such a short time period. I think there will definitely still be virtual hackathons that happen, and then there will be also in-person hackathons that we will go back to doing as well.
Okay, and then how did you approximate the in-person collaboration? Were there any tools you used? I know I wrote an article in Forbes a few months ago about brainstorming when everybody's remote. And there's certain tools like Miro that enable you to do like real like Post-its and move things around. And there are tools, because there's so much brainstorming now going on for all different types of businesses, not just hackathons. So were there any like new tools that you tried using? Is one question. And then another one, are there any things that you learned about the virtual hackathon process that you would do that could improve further on virtual hackathons?
So in terms of tools, we stuck to the tried and true of Slack and Zoom as our primary methods of communications with participants and mentors. We did advocate for the use of Miro and other similar tools as well for participants to use. But I think it's the fact that our team really took a very hands-on approach. I think compared to some other hackathons out there, the organizing team is very heavily involved with each of the hacking teams, so to speak, in terms of their ideation process throughout the weekend. In terms of learnings from the virtual hackathons, you mean more on essentially the execution side of?
Yeah.
So I think, we've certainly learned a lot, and I think we've certainly optimized and streamlined it fairly well under the current sets of technologies. I think moving forward, what would be interesting to see is how we can better emulate some of that real-time interaction that happens seamlessly, whether that's, some people have started to, I think some of our recent iterations of our hackathons that we did, I think with Google, we explored the use of Discord as a way to facilitate that instead of using Slack. But I think the next hurdle is how do we create more of that telepresence in real time to happen so that we can have more of that, quick to and fro type of conversation that happens and to ideate faster.
Like maybe in the future, you could use VR. I don't know how this is immediate, where you all feel like you're in the same room. I saw something at NYU's in their Tanner School of Engineering, and someone had created Shakespeare play Hamlet, where you felt like you were in Elsinore Castle and everything was all around you. And so I could see how you might be able to somehow replicate. I've seen a few different examples of this where, people who are in different locations can feel like they're physically in the same room.
Yeah.
Yeah.
I mean, I think that telepresence is key. I think the other challenge of virtual hackathons is that normally we would, for example, have access for the participants to have for prototyping facilities and building more of the hardware development. And I think that that's the limitation of the virtual environment, is that we can't get that access for participants, right? Especially when they're spread out globally. So it does change a bit what the types of solutions that come out of the hackathons versus the in-person ones.
Maybe there's a way of 3D printing. I mean, I don't know. You develop the instructions together and then send it to a 3D printer, and even they 3D print it all over. Who knows? But there could be probably a lot of interesting technology in the future.
Yeah, we were actually talking with some companies that were essentially, they had basically an asilico model essentially to be able to test out prototypes onto. So even though you weren't physically 3Ding anything or physically building something, you could kind of submit, here is the the drawings or the for making this, and then kind of being able to run it under some virtual simulation type of testing of how well it would perform under certain conditions. So that type of thing, I can certainly see taking off, because now, I mean, this is also being used in industry as well, right? As they're prototyping new products, as well as that they no longer have to physically build something to kind of at least ideate and test and validate initially before they get to this future products.
Super interesting. Can you share some of the successes that came out of this hackathon? Were there any ideas that you're able to share? That's one question. And another is, who owns the idea? If you have like random people put together and they come up with an idea, maybe one of your sponsors or one of the partner companies, it might fall into their bailiwick, because the goal of this is to scale it and introduce it as quickly as possible if it looks, viable and like it's a good idea. So can you just talk a little bit about how you go from idea to ownership and scaling and bring to market, commercializing?
Sure. Some of the notable ideas that have come out and that continued forth since the hackathon, one was really trying to attack the misinformation or disinformation campaign. This is a team called Viral Science that was trying to basically figure out ways how to make correct scientific information just more palatable for the regular person, and how to make those more virals in a sense, given its name. Another team was one called Pack, and they were trying to tackle the problem of essentially N95s and how to sterilize them. Most hospital systems have huge facilities or large rooms to be able to sterilize them on a larger scale, but how do we do that in underdeveloped areas and rural areas where they may not have access to that equipment, so that we can essentially just sterilize smaller amounts or individual N95 so that we can maintain a longer lifespan for those. And so they were trying to develop essentially a portable UV sterilizer for those N95s, and that was a team out of UPenn that was developing that. And then we had a team that was headed by one of our students here at MIT called Weeple, and what was remarkable about this is that they came up with this idea even way before the concept of pull testing for COVID specifically was even on the radar for most of the community. And their thought process, can we more intelligently pull specimen together? Because right now the caveat of pulling samples together is that if that turns out to be positive, now backtracking back to figure out what one out of the X number of samples you pulled is really the one that is positive, would be a challenging process. And so basically their thesis was, can you, based on other factors about, the patient, the prevalence of the infection rate in that particular geography, better informed, essentially, can you pull the ones that have the least likelihood of being positive together, so that way you can increase the amount of samples that you can pull together, and save the amount of testing that needed to be done that way. And so some of these, are still going now, some have obviously incorporated, some have filed for provisional patents already on some of their technologies. And so it's been really nice to see that development happen. In terms of what happens to these ideas after the hackathon. So for the purpose of these particular, the MIT COVID-19 Challenge hackathons, because we want these solutions to really get implemented as quickly as possible, after talking to various entities, we thought the fastest way was to leave whatever was being developed at the hackathon itself in the open source space. And so anything that was developed at the hackathon itself was open source. That way, either the participants or the partners and companies that were involved as part of the hackathons could take those ideas forward if they wanted to. But of course, anything that happened after the hackathon, the teams could own and facilitate, develop the IP around that on their own, so to speak.
So just so I understand, so either companies can say, I'm interested in taking this idea, or the entire team itself could say that we want to work on this together, moving it forward. Are there any issues about ownership, like who created the idea? And I don't know if it ends up being messy, or it's just part of the process that people know their ideas may be taken for the greater good.
Well, I mean, I think so everyone certainly signs essentially an agreement when they join to the hackathon that they know this is an open source, that these ideas are being developed under an open source license, and that could happen. But we do have very good relationships with all of the companies that worked or entities that worked with us as part of the hackathons. And so they, certainly would give deference to the original team to pursue and develop initially. But we do provide that outlet of, if the team decides not to continue further with it, but the company has, or the hospital system has an interest in pushing this idea further, then they certainly have that capability to do so. So, I think it's a hard question to answer in the sense of like, who really owns that? Because I mean, obviously the initial idea is in the open source space. But it's anything that's developed after the hackathon, I think is, obviously to whoever that happens to be. If that's the team continuing on with it, that's who owns that IP and that idea. If it's, the entity, the company, or partner organization that decides to move forward with it, that's, within their purview as well. But ideally, it's, and most of the time it's been that the original team has continued on with it, and they've engaged in a relationship with a partner organization to facilitate it further.
It's very exciting. And then you shared your takeaway about the things that can be improved and what some of the lessons learned were. But I'm just curious, maybe the same answer. What was the feedback from the participants about just the whole process? I'm sure they were very energized by it and excited because they got the chance, like you talked about, democratizing accessibility. So I'm guessing people got to work with a more diverse group of people as a result of this, because you made it so open and broad and, and communicated it so well. But was there any additional feedback from the participants as to what they liked about it or thought could be improved?
Yeah, so I mean, I think what they certainly liked about it is that, first of all, that we actually hosted these to begin with, and then actually had these partnerships develop with these other entities, because it really allowed them to have a venue to go to after the hackathon to continue that development or continue that mentorship and that active feedback mechanism into what they were developing from those key stakeholders. I think the other part was the process of our particular hackathons itself, because I think our hackathons are very different from the prototypical software development hackathons that maybe a lot of people are familiar with. Is that, it's not just about the solution you're building, but we really spend a lot of time with the participants on the problem definition component as well. I would say, a third of the time is spent on getting the teams to truly define that problem and getting dig deep into that aspect, because if they don't have that well defined enough and specifically defined enough, the solution they built is not gonna matter as much, right? Because it might be trying to solve a problem that's too big and maybe solving a tangential problem that's not really what they're trying to tackle. And so making sure they have a well-defined problem and making sure that the solution that they're developing really truly addresses a very specific problem. And then the third component is that we really emphasize for them to think about also the business plan and the viability or feasibility of these ideas as well. So it's not just important to build out the code and the AI and the app and whatnot, but it's also important to think about how will this pay for itself? How will this ultimately get integrated into the current workflows, whether that's on the clinical side or the patient side? Because if you don't think about those logistical components, that can easily kill the idea as well, if it's going to make things even more complex than the current workflow is, or if it's going to take more extra time for something to accomplish that same goal, then it's not going to get adopted or implemented as well. So I think they certainly appreciated that intentional education on the focus on those three aspects and not just the solution development component.
That's great. That's great. So was there a judging process? In a way, it seems like if certain ideas emerge that appeal to certain groups or some of the partners, that's how it would move forward. But was there so I've seen with some hackathons where there's a judging process and the groups that their ideas are found to be the most viable and worth pursuing, they get funded. Was there any aspect to that?
So there is a judging process, and as part of that process, it focuses on the four areas which I kind of outlined before. One is essentially on the impact or the problem and how well that's defined, the innovation, which is the solution component itself, and then the third part is the implementation. Essentially, like if they got funded that weekend, what would they do over the next 3 to 6 to 12 months to turn this into reality, so to speak. And then slightly a business plan attached to that too. So there we had judges in each of the different tracks of each of the hackathons. Usually it's a panel of 3 to 5 judges that covered a full spectrum, everything again from the various stakeholders. We had some who were investors, some who were startup CEOs themselves, some who were on the clinical side, some who were on the governmental side as well. So really a wide breadth of individuals who could lend their expertise and their perspective as part of that. Winners did get some nominal funding prizes from the hackathon itself, but from our past experience, we've never seen a direct correlation between who wins at one of our hackathons and who ultimately succeeds in the long term in terms of having a viable commercial product and startup 12 months out from the hackathon or longer. And so what we've tended to do is more focus on providing as many opportunities as possible with our partners and other organizations, and for as many of the teams as possible. So trying to lift all boats, so to speak, and kind of think more further down the road at maybe 3 months down or 6 months down, and providing more follow-on funding to the teams that actually have progressed well since the hackathon, because then they demonstrated not only that they have a good idea, but that the team also has the drive and the determination to push this idea forward as well. And so that's essentially the way we've structured at least the funding mechanisms for some of these teams.
Well, this is fabulous. So I have one last question for you. What do you think that companies outside the field of medicine can learn from this new way of conducting hackathons? Because I've been conditioned, because for the last 7 years, I've been writing articles for Forbes CMO, Chief Marketing Officer Network, learning from other sectors and what CMOs can take away from this. And a lot of CMOs are oversee product development. So brainstorming and ideation. So what do you see that the main things that you learned that could be relevant outside the field of medicine?
Yeah, so I think there's definitely a few. I mean, one is, providing a forum in which everyone has an equal voice or input into the ideation process. And I think that's what the hackathon does. It really levels that playing field where somebody who is an undergrad versus somebody who is a mid-level or senior exec in a company can come together and ideate around these problems from their various perspectives, but have that equal voice in the process. I think two is the multi-stakeholder approach, is ensuring that you have that diversity of perspectives on those teams. Everything from, as I mentioned, from the end users to the people who are engineering or building this, to the people who are going to be commercializing and scaling this up, to the people who are going to be prescribing. And in healthcare, it's certainly much more complex, I would say, than in other sectors, but which is why I think it's still a good model that other sectors could adopt, because at least in healthcare, whoever is prescribing the solution versus buying it versus actually using the solution are usually three different entities altogether. So I think, those are some of the learnings I can take from the hackathon. I think the last one is what we often say is the iteration process, which is, we always like to say, fail fast and pivot. And so we want people to iterate through this process very quickly, and to, of course, do due diligence to particular ideas, but to really rapidly continue to iterate and ideate along this process. Because I think what we often come to find, especially in corporate cultures, is that that innovation process tends to take a long time, and it's bogged down in a number of other processes. So trying to get people used to saying that let's just test this very on small scale and see where it goes, and if it works at least a little bit, then we know which direction to continue to improve on it and keep moving it forward, as opposed to waiting for something that's way too mature before you go out and test and validate it. So.
That's fascinating. That's really wonderful. So are you going to, once you're done with your program, are you going to stay involved in I don't know, hackathons and ideations and innovation, or are you going to be more practicing traditional medicine?
Ideally, a little bit of everything. So I still hope to still do some of my own primary research as well, and then doing some clinical medicine, but definitely still staying in the innovation entrepreneurship space. Don't know if it'll be hackathon specifically, but I think there's it certainly needs to be more people who understand all of those three sectors and how to really, again, accelerate that process from ideation to impact, in my opinion. And so I hope to stay involved along those.
And it sounds to me like you've learned so much through this process that you're going to bring to whatever work you do on new idea development.
Exactly.
That's what's wonderful. So if anybody would like to get in touch with you, what's the best way? What do you suggest?
They can certainly find me on LinkedIn, but they can also email me at Freddy TN, FREDDYTN at MIT.edu.
Freddy TN. Okay. Say it again. Freddy TN at
MIT.edu.
.edu. Okay, wonderful. Really fantastic. Thank you so much. This was so enlightening. Really appreciate it.
Thank you so much for having me, Michelle. It's a pleasure.